Good morning, everyone. This is Dr. Debbie Hamilton, and thank you for joining me today. We are going to talk about why is my child reacting to everything, really going into something that people are talking a lot about in integrative medicine, which is the whole issue of mast cells, which I'll explain. So I'm going to speak first. There is an area on your computer that you can do questions on. So I'm going to talk first, and then I'll answer all the questions at the end. If you do not get your question answered, please just email me, and we'll go from there. And so the reason I am interested in this topic is it's coming up at a lot of different integrative conferences. So it seems like many of these chronic diseases that have this underlying mast cell issue, this immune allergic issue, that's causing a lot of the symptoms, and is the reasons why some people don't improve. But in addition to that, we're seeing a lot more allergies and asthma, eczema, and stuff like that in children. So in terms of food allergies, this has increased a lot, especially in children. Now they're saying 1 in 12, and this is with students with food allergies. And obviously people know a lot about peanuts and nut allergies, milk and gluten. But this is interesting because this talks about just immediate allergies. And most people know about immediate allergies, right? The thing about you have hives right away, or you have peanuts and you have anaphylaxis, which is the emergency allergic reaction that it can be fatal. That's why people have EpiPens. But this doesn't take into account all the food sensitivities, a lot of the gluten issues, a lot of the milk issues. So 1 in 12 is probably much, much higher than that in terms of food reactions specifically. And then asthma. So it's about a 10% rate of asthma worldwide, but it's been increasing yearly. So again, I think there's a big component of air pollution, especially around the world. And asthma is an allergic lung disorder. People know what asthma is, right? You can't breathe, your lungs tighten up, you get a lot of inflammation. Again, it can be very serious. And then there is something called kind of the allergic march, and I learned this in pediatrics, that if your system is allergic, which is called atopic, then you can have different kind of symptoms, and as children get older, it can change. And I usually see not as specific as this, babies have the eczema, which is the skin rashes, then they have all the food allergies, and you tend to see asthma later, and then rhinitis. So I see kind of a lot of kids who have some of these or all of these. So that used to be kind of what we saw in pediatrics, and now I see a lot of kids who have food allergies and eczema, some asthma, rhinitis, a chronic, stuffy nose kind of symptoms. And then the question is, why is there an increase in allergic symptoms? And if you just think about our foods, what is in our food? All the different chemicals. So anything foreign that is exposed, especially inside your body, is going to cause your system to go, hey, this isn't supposed to be here. I got to fight this. And that basically your immune system is coming and reacting to it. You get an allergy or eventually an autoimmune disease. There's also genetically modified foods. So there's a study that looks at kids with soy allergies. And if they have genetically modified soy, there's a much higher rate of allergies than if they just react to soy. So again, if you have a genetically modified food, right, GMO, which is why it's really important to do GMO free. So there's a different protein in that food that your body is not used to, that's not in nature. For air quality, I talked about the air pollution. There's been over 80,000 environmental chemicals released in the last 50 years. Most of them have not been studied in humans, and definitely not in children. And then it comes into the whole microbiome, which again is a huge issue that we're just starting to learn about. But if you have a lot of antibiotics, you kill all that good bacteria in the gut. A lot of our vaccines have antibiotics. Our animals that our meat supply has antibiotics. This creates a poor immune response and actually can lead to a lot of allergic issues. So poor immunity, genetics, definitely there's some people who are more susceptible to allergies. If you've got, parents with allergies, autoimmune disease, the children are much more likely to have allergies. A poor microbiome I mentioned, any kind of chronic infection is really stressing your immune system as your body tries to fight this, and that's going to create a lot more allergies. And I'll talk a little bit about immune balance later, which is partly why we see so many of these allergies and so many immune issues. If you have a chronic inflammation, like a chronic infection, then that can actually lead to a lot of allergies. Mold, we're learning more about mold exposure and how that triggers the immune system. And that is a huge, huge trigger for the mast cell stuff I'm going to talk about. And then there's this whole thing called the hygiene hypothesis, which really ties into the microbiome. So, people worry about, we wash our hands all the time. Kids don't get an infection as much. They're not exposed to much germs. They're not exposed to as much soil. And so basically their whole immune system is not developing enough. And if you think about the immune system, since it's not developing a normal immunity, you start to get more allergies. It gets imbalanced and you get more overreaction towards things in the environment. So a lot of things to think about and how our environment's changing and how this is really increasing all the allergies that we're seeing. And there are different types of allergic reactions. So people know, think about, God, I got hay fever, got the runny nose, the nasal symptoms. Sometimes with food, you get a lot of digestive symptoms, asthma, wheezing, obviously diagnosed asthma, eczema, hives, anaphylaxis, which is, the life-threatening acute reaction. And then I'm going to talk about something called histamine intolerance. And what people are calling in integrative medicine is MCAS. Sometimes it's called MCAD. It's mast cell activation syndrome. And that overlaps with a lot of our chronic diseases. And then something called mastocytosis, which is very rare, but very different than the mast cell activation syndrome, which is we're starting to see more and more of. So I'll kind of go through the differences of those two. So food allergy symptoms. I think the thing about food allergy, and there are food allergies, like I said, there's also, most people think about food allergies. If you talk to an allergist, a food allergy is an immediate, what they call an IgE, immediate reaction. But we're learning a lot more about food sensitivities and delayed food allergies. So the symptoms aren't just, right away. They can be within several hours to the following day. And you can obviously get skin stuff. We can get breathing stuff. If you ever have, your throat closes up, you feel itchy, and that's more immediate and that's more serious. A lot of GI issues, you think about food allergies, right? You can get nausea, stomach pain, vomiting, diarrhea, even constipation with food reactions. Cardiovascular, kind of feeling unsteady, especially more with acute. But I think that we need to think about, especially in our children, are some of the neurologic symptoms of food allergies, especially food sensitivity. So brain fog, or kids who have problems paying attention, or really cranky, irritable kids, or you can even get kind of mood symptoms. And I think it's really important if you see a child who eats something and then several hours later, the next day for 24 hours, they're really off. You have to think about it. If they do that too, and then they're kind of spacey, or maybe the nose runs a little bit, these are all things to think about in terms of food allergies. And I think that neurologic piece, that brain piece, that mood piece is really important because that can really affect how a child does in school. And also how you do as a parent, how they do at home, right? So environmental allergy symptoms are much more the respiratory symptoms, the nose, the eyes, breathing, kind of itching, kind of the general thing. Think about that hay fever stuff. So eczema is kind of an allergic skin rash. Again, you often see it in babies. It can be any part of the body, and these are pictures kind of on the arm and in the cheeks. On the cheeks, it's pretty severe. I mean, it's kind of dry, patchy. It can be circular. It can get really big patches. It is really itchy and really uncomfortably miserable for kids. And it often goes with food reactions. If I ever see eczema, you have to look at what are they reacting to. You have to think about that their microbiome, they do not have a good microbiome. They do not have the good bacteria they need. And often they're missing certain nutrients. A lot of times they're fatty acids and things like, I said, probiotics to help. But you also have to kind of support their immune system to balance again, because we do know. Hi, somebody just let me know that the pages are not turning, so I will see if I can go. There we go. Okay, I'm just going to go back and so people can see this. Technology always does this to me. All right. So, and I can give everybody slides of this afterwards. So, okay, so this talks about asthma and the rates. This is the different, how the allergies change over the years. Some increase in allergic disorders, just the different things, different types of allergic reactions, the food reactions. And I'm just going to go to eczema here. Great. Okay, so these are just pictures of the different eczema. And again, you can see it really in any age, and I think that's important. All right, people, I thank you feedback here. Okay, great. So this is an example of hives. And hives is interesting because I said you can get hives immediately. You can have a delayed reaction to hives. You can have an environmental reaction with hives. It's definitely an immune system reaction. The thing about hives, it can be really the whole body patching. And if you press on hives, it kind of blanches, so it kind of turns white and then red again. As opposed to eczema, if you press on eczema, it's dry, it's not going to change color, right? So that's kind of one of the things to hives. So this is, so mast cell activation I'm going to talk a lot about, but it has some of the strangest symptoms that can be all over the body. But you can get kind of this flushing and this redness, and it looks a little bit different than the hives, which is, tends to be more kind of big circular dots all over the body. I will say with, sometimes I have kids who have a phenol reactions, and those are reactions to certain components of food, and then you get that red ears also. And because of that, that actually, phenols might actually be kind of the mast cells, and we should probably think about that too with your child, if that's an element of that reaction to phenols, is kind of they're triggering the mast cells. Now this is mastocytosis, see how dark it is? And again, this is very rare. And mastocytosis means you have too many mast cells. Well, mast cell activation means those mast cells are just, you know, they're basically triggered too much, right? You don't have an increased number if they're just being triggered too much. And I said mastocytosis can be serious, can lead to certain cancers, but is much more uncommon. So histamine intolerance. So histamine, think about antihistamines. You know, you have allergies, you take antihistamine, say you take Claritin. So that medicine is trying to block the chemical called histamine, because histamine is what causes a lot of the symptoms. Now, mast cells are the immune cells. They're the white blood cell in the body that releases that histamine, which is why if the mast cells are basically going crazy, they're releasing a lot of histamine in the body, which is causing a lot of the symptoms. The histamine intolerance has much more to do with the digestive tract and food, because there's a lot of our foods have histamine, because histamine is actually an amino acid. Like, you know, like think of our proteins we eat are made up of different amino acids. And so histamine actually is derived from a different amino acid. So it's kind of an offshoot of amino acid. But so in your body, if you eat too much food containing histamine and you're sensitive to histamine, you can get more histamine symptoms like allergy symptoms. And sometimes you can basically just absorb too much histamine from the food. And sometimes with the histamine, there's something called DAO. DAO is an enzyme, and that breaks down the histamine. So if you don't have good bacteria in your gut, then you might not have enough that DAO enzyme, and you might not be breaking histamine down. And then there's some things that you might be eating or medicines that basically block that enzyme, so you can't break down histamine, which is why we're kind of seeing a lot of this issues also. There we go. So histamine intolerant symptoms are, as you would think, anything that histamine do, so any kind of allergic symptom, but it's a little more than that. It can be more intense. It can be headaches. It can be migraines. People who get random migraines, if they don't know, maybe they look at not just one food, maybe look at the combination foods and look at, do a lot of these have high histamine? Or am I doing something that's kind of that blocking the histamine? You can have any kind of respiratory symptom. You can have like muscle and joint pain, any kind of digestive symptom. Some of those, those symptoms like your heart's racing, you're kind of feeling dizzy, things you can get with kind of like allergic symptoms, and then any kind of skin rash. Now going into mast cell disorders, and if you have mast cell activation, that's a release of histamine, but it's also a release of other different chemicals from the mast cells. So it's even more symptoms and can be much more severe. Now, as I said, in terms of mast cell disorders, mastocytosis is an increase in number of mast cells, and that's very rare. And I said that can be serious. But what we're seeing a lot now is the mast cell activation syndrome, and MCAS is what it's the short version of it. So it's an abnormal increase in activation of existing mast cells. It's like mast cells acting badly, basically. So here, as you can see, is a list of all the things you can find in mast cell activation syndrome or mast cell activation disorder. And I think the most important thing about mast cell activation syndrome is that it can affect any single system in the body. It affects a lot of different systems. So if you go to a doctor and you say, my ears itch and my eyes are dry and I've got swollen lymph nodes and I get wheezy or short of breath and I feel dizzy and my stomach hurts and my joints hurt, think about the kids, and sometimes kids can't really even explain all this, and I got this rash that comes and goes. So if you really all those different symptoms, and some of them, doctor, if you looked at this, it's like, wow, you have this and this. If you don't think about mast cells, it doesn't really make sense, right? They don't follow, it doesn't follow fibromyalgia. It doesn't follow kind of one specific disease. And I said it often goes with some chronic diseases. So it can be kind of hard thing to diagnose and hard thing to think about. And because we're seeing more Lyme disease and more chronic disease and more mold and more allergies, we're seeing a lot more mast cell stuff. And I said, even in children. And then, as I said, I take care of a lot of children with autism, and they're really doing a lot of research with mast cells and autism. As you think about children with autism, they have Lyme disease and they have all sorts of infections, and their immune system is weak and they have allergies. It's like, wow, we have mast cells. We have a whole nother layer of things we have to look at and try to treat, right? And I said, a lot of our kids just can't tell us, wow, this hurts. They just act out. And so this is trying to break it down, but some of the same idea. Systemic means symptoms in the whole body, like just really, really tired. Skin reactions are really common, as you mentioned, the cardiovascular symptoms. And if you look, I'm going to go back to this one. So if you look at the cardiovascular symptoms, and we're going to talk about POTS syndrome, and you look at all the symptoms of POTS, they're all can be explained by mast cells. So I'm wondering if the whole syndrome of POTS is really primarily a mast cell issue. And again, I think we haven't really been able to understand why some people develop that. And so it's something to think about in terms of mast cells. So then okay, this is what the problem is. So then how do we diagnose it? Can we diagnose it? And so in terms of, let's go back to like food allergies and sensitivities. If you go to an allergist, they might run a blood test and they test for something called IgE. And the test in front of us shows a panel of different kind of antibodies. And IgE, IgG, all of those are what we call different immunoglobulins or antibodies. So those are just proteins in the blood that are released in terms of a reaction to something. So if you have an IgE antibody, it's released right away. It's the immediate histamine reaction. Where the IgG is more kind of a delayed, but it can be the whole body. And IgA tends to be in the digestive tract. That IgA is the main antibody in our digestive tract. So then you think about mast cell testing. The thing about mast cells is they release histamine, they release all these different chemicals, and they're not in the blood very long. So if they're not in the blood very long, then it's hard to do a blood test and to measure it. Does that make sense? So the thing about it, so it's hard to, measure get the right timing to see if things are elevated. And the other thing about the blood test is you have to get the blood, you have to put the test on ice right away to make it accurate. And even if there's mast cells, because they're only mast cell activation issues, the blood test can be all negative. And then some of them are 24-hour urine tests, which, as you know, in children is definitely not an easy thing to do. So in general, the blood test, a lot of the adults do that, and I have run some blood tests. I don't do the urine test. And sometimes I find them elevated. The classic one is tryptase, which is on the bottom of the list. And if you get tryptase, that's a positive diagnosis, but you don't often get it with mast cell activation. You much more often get it with mastocytosis. But as I said, it's still something we do sometimes. But the main thing is if you have the symptoms, then you have to really think about it as a clinical diagnosis, which means you just diagnose it from symptoms and then still treat it. So the other thing about mast cells, as I said, it releases histamine. They release tryptase, prostaglandins. Think of prostaglandins as like if you take Advil or like aspirin, you're blocking the prostaglandins. So those are another chemical in our body that causes inflammation. And then there's cytokines, which are another chemicals in our body that are released by cells to tell other cells what to do. So a lot of different, and this is just a short list. There's lots and lots of things. And I said, I think we're going to find out more and more. So it's important to know that the mast cells are part of the immune system. And the immune system are white blood cells. So say you do a CBC, which is a complete blood count. On it, the first part is, we'll say WBC, and that's white blood cell count. And then it kind of breaks it down into different cells. So this just shows that we have innate immunity, which is like the immunity that hits right away. And then adaptive immunity, which is immunity kind of like almost like immunization. It's like, hey, I had chickenpox. My adaptive immunity tries to fight chickenpox. So next time I'm exposed, I don't get it. The mast cell plays a role in a lot of different immune things, which is why we have so many different symptoms. And this just shows what a normal mast cell is. And then it gets activated, it literally releases all those little purple dots, are granules, and it releases all those different chemicals, histamine, all those things. So you can imagine if you activate one mast cell, how many different chemicals into your body and how much it can affect all different systems. So histamine per se, as a chemical, causes things like the blood vessels to dilate. But think that means like that's why you get flushed. All of a sudden you get more blood flow to the skin and the extremities. That's where you get the higher heart rate, release of adrenaline. That's why you kind of feel like you're wired. Bronchoconstriction, that's where your lungs kind of, they close up. The vessels close up so you can't breathe as well. It actually also causes kind of like GI symptoms, and then the pruritus is basically itching. So this shows how histamine from mast cells is related to inflammation. And I think about inflammation is, say you hit your hand. Well, your hand gets red, it gets hot, the heat, it gets swollen, and tenderness and pain. So there's a lot of things in our body that can cause inflammation, but this shows that if you have mast cells that are activated, you basically get inflammation. And inflammation is the basis of a lot of our chronic diseases, which also means that if mast cell activation causes inflammation, that part of our way to treat the mast cells is we need to target the inflammation also. And I think that that is a key piece. And really, we need to target the inflammation in any kind of system. Because if you have pain, you have inflammation, right? So think about like an Advil is an anti-inflammatory. It's taking down inflammation, so it's taking down your pain. So this is a list of diseases associated with mast cell activation. So these are diseases that can be associated. It does not mean that every single one of these diseases always has mast cell, but you have to think about in any chronic disease, especially when you have a lot of different symptoms that don't just go with the disease, that maybe there's some mast cell issues that you have to address. And I look at this list and I'm like, this is pretty much, maybe not the infertility, right? I'm not a women's doctor, but a lot of the different things that your kids have or that people I see have. A lot of things about irritable bowel, something that, it's just, it's no real cause of it. I was like, well, mast cells can contribute to that. Imbalanced bacteria contribute to that, because if you don't have the good bacteria in your intestine, your immune system is not going to be working well. So dysbiosis is like, biosis is life. So dysbiosis is like you have abnormal life, like abnormal bacteria stuff in your gut. Candida is yeast in your gut. CIRS is chronic inflammatory response syndrome, which is, when these people have like really bad Lyme and really bad mold, you get a lot of inflammatory symptoms, really like a lot of the mast cell symptoms. You get, symptoms in all your body systems. You can be really, really sick. Obesity and diabetes, asthma, allergies, autism. I think we need to really look, and all of our children with autism, at the mast cell piece and the inflammatory piece. Autoimmune diseases, celiac disease, right? The gluten autoimmune disease. Any of our skin issues, any of our food issues, any of our really almost any kind of chronic GI issue. POTS, I talked about. People have like chemical sensitivities, or EMF sensitivities, right? You go in someplace and, oh my God, that I can't stand that smell. It makes me sick, right? Migraines, chronic migraines, mold I mentioned, fibromyalgia, chronic fatigue, any of our autoimmune diseases like MS, and then all our tick-borne infections. I think we're seeing a lot of that at the last Lyme conference, the ILADS conference. I feel like about a third of the lectures were actually on mast cell activation syndrome. And this is Dr. Afrin wrote something, Don't Bet Against Akram. And it's this huge book about mast cell activation. And I like this. It's hard to imagine a disease more complex than mast cell activation disease, which basically means we are just beginning to understand what is going on here. So I'm going to talk about POTS because POTS you tend to see it in teenagers, although I would also say in young women too. And I think it's interesting that if you look at a lot of the different chronic diseases that people know, from like lupus, rheumatoid arthritis, autoimmune diseases, that probably a lot more have POTS. It's not always identified because a lot of the chronic symptoms will overlap with different infections and different diseases, but it can be really disabling. And I think if you have POTS, you really have to look at what else is going on. You got to look at mast cells, but you also have to look at what is causing some of this. And profile, I said, is more often in women, but you get things like fatigue, dizziness, palpitations, fainting, blackouts. And the official diagnosis is, that you essentially, you have your nervous system, your autonomic nervous system is supposed to regulate your pulse and your blood pressure, right? So when you stand up, your pulse doesn't, your heart rate doesn't go crazy, like really, really high, and you don't pass out. But with POTS, that this doesn't regulate very well. And so you get a lot of, as I said, very interesting symptoms from headaches and stuff, dizziness, passing out, really the abnormal heart rate and regulation. But you also can get are interesting different modeling, right? Because you have the mast cells, and mast cells like to live near the skin, which is why you see a lot of skin issues. They also like to live the lining of the digestive tract, the lining of the sinuses, which is why you have allergies, you get the stomach issues and the sinus issues. But this is kind of the interesting modeling you get. And if you think about histamine, affecting the blood flow around your skin, you can understand why you'd have that different coloring. So something else that goes with mast cells and POTS syndrome is something called Ehlers-Danlos. As you can see from the picture, it is a connective tissue disorder. So connective tissue is, you got your bones and your muscles, and the connective tissue is kind of part of your skin and part of the fibrous tissue that holds everything together. So if this is weak, it means that things can bend. So there's more of a hypermobility symptom, and even like your skin will be more stretchy. But if you think about mast cells being around, like very under the skin, then you can understand why this might be connective tissue, might activate the mast cells a lot. But you see this with POTS too, this triplet, all three of these together. So if you see Ehlers-Danlos, if you really have a hypermobile child and a lot of different strange allergic symptoms, you need to think about this. So I'm going to talk about something called neuroinflammation. And just like I said, that inflammation is basically, the redness and the swelling. It's like your immune system is trying to fight something. And if it's chronic, it means it's trying to fight it too much, and it's basically going on too long. So neuroinflammation is basically inflammation in the brain. And so we see neuroinflammation in things like autism, ADHD, PANDAS, which is an autoimmune disease of the brain, any kind of neurodegenerative diseases, you have stroke, or you have a head injury. And the mast cells play a role in this, contributing to basically telling some of the other parts of the immune system to also kind of overactivate. And this is how mast cells play a role in neuroinflammation, and also how mast cells play a role in autism. And which is why when we have to address this, we really need to do this. Now this is about mast cells and neuroinflammation, but mast cells and autism. So there's a doctor, Dr. Theorides, who's done multiple studies on autism and mast cells. And this is a slightly complicated slide, but I think the most important thing is if you look on the right side, there's the gut. And anybody who has a child with autism or who has looked at it know that children with autism, adults with autism, they have digestive issues. And the problem is the gut, even things like casein or gluten in our foods can trigger mast cells. And there's also things in the brain that can trigger mast cells. So here we have a gut-brain connection, and then the mast cells release all of these different chemicals, even neurotransmitters like serotonin, growth factors, and all these things that contribute more to a lot of gut problems, more gut-brain problems, more inflammation, and really is kind of a thing to think about in terms of autism. So I do think in terms of our children, obviously you need to treat the gut, but part of that is also looking at the mast cell connection to the gut-brain issues. And here it talks about irritable bowel syndrome, which is supposed to be just kind of a functional disorder. I love that in medicine, a functional disorder, which really means we don't know why. And now we're learning a lot more. If you have irritable bowel or just like, abnormal digestive stuff, you got to look at the microbiome, got to look at those good bacteria. But you also need to look at mast cells, because mast cells line that gut. And if the mast cells, it's like bad mast cells, if they're angry and they're releasing all these chemicals, it's going to influence the motility and how people are feeling. And then Lyme disease. So a lot of patients I've seen with Lyme, Bartonella have chronic mast cells. And so just if your children are having a lot of allergic symptoms, and especially things for Lyme disease, one of the key things you see is rotating pain, right? So, hey, my hand hurts, my knee hurts, my hip hurts. So it's kind of interesting that that's really specific for Lyme, is that migratory pain. That's what they call it. They call it migratory pain, meaning it's moving. Fatigue, which is sometimes hard to tell in kids. Pain, cognitive things, some of the mood and things, and then chronic headaches, right? And people know that Lyme, the erythema migrans, that bullseye rash, is a classic Lyme rash, but only about 50% of people who get bit by a tick will actually have that. So you can have Lyme without having any rash, and that's a classic rash. Sometimes it just looks like a little rash in the middle. So a lot of different rashes, it can really vary, but you can have Lyme without ever developing the rash and without ever knowing about a tick bite. And now we're probably fleas, there are probably other bugs that actually can do that too. So Lyme disease also can go with a lot of other different infections that can live in ticks. The two most important are something called Babesia, which is a parasite, a lot like malaria, and Bartonella. And Bartonella is actually an infection called cat scratch disease. So sometimes animals can carry that also. And while Lyme disease is all over the country, really all over the world, you know, I'm from Connecticut and we had a high amount of Lyme, and I've actually had Lyme in the Northeast. And we definitely see probably more Bartonella, you know, in Colorado and some of the Southwest. So I think about. So tons of symptoms of Bartonella. The one thing there's only a few things that are really important. Bartonella is a neurologic disease, causes a lot of serious rage, mood, like just pandas kind of behavior. And I think that if you have a child who has a lot of that behavior, because Bartonella can cause that PANS autoimmune issue. So if you have a lot of mood issues, and then you have something like this is a Bartonella rash. Or if you have just kind of, you know, that rage behavior with fatigue and with kind of some pain or things like that, just to think about. Bartonella rash looks like stretch marks that are horizontal. Like most stretch marks can, you know, go up and down. They're vertical. They go up and they can be raised and red and angry. So this is just kind of a sign to think about, because all these infections are very much associated with mast cell, and they go together. So Babesia is a parasite. Some of the classic Babesia symptoms are something called air hunger, where you literally can't catch your breath. Really night sweats and really pretty profound fatigue. And then with all of these, there's strange neurologic tingling and numbness and, you know, all sorts of, you know, brain fog symptoms, depression and just paying attention and things like that. But all of them can go with the mast cells. So I'm going to talk about some treatment options. So, you know, kind of, you know the symptoms, kind of know kind of how to diagnose, which is really basically clinical. Think about all the different things we associated with and all the different symptoms. So then the question is always, all right, well, what do we do? Well, think about allergies. You obviously have to avoid the food and trigger, making diagnosis for those. Sometimes some of the air things, there's air filters, often air is one in the house. There's antihistamines. There's natural and prescription antihistamines. For allergy specific, there's oral immunotherapy and allergy shots. And then with allergies, I always think, while your immune system is not balanced, you've got to bring that immune system back to balance. So if you have histamine intolerance or even mast cells, the diet is another, you know, if you already have your body reacting to mast cells, you're eating a lot of food in terms of histamines, that's just going to add to the problem. So there are certain things you can do. There's actually a supplement. It's DAO, it's diamine oxidase enzyme. HISDAO is one. And basically what you're doing is you're taking that enzyme with food to try to decrease the amount of histamine. Basically, you're breaking down that histamine in the gut, so you have less histamine in the body. Now, there's certain things that just naturally block the DAO enzyme, alcohol, NSAIDs. NSAIDs, the main one is like Advil. Advil is an NSAID. interestingly, some of the antihistamines that you use to treat allergies can actually hurt that enzyme, right? So you're trying to break that down, and then, you're taking a medicine to decrease histamine. If you have chronic, dysbiosis, you've got gut issues, which a lot of, people do, a lot of children with autism do, then you're going to have less that. You're not going to be able to break down the histamine as well. You got nutritional deficiencies, vitamin C, B6, and then you can also have genetics. So some people just like the MTHFR, you have that, the enzyme doesn't work as well. You can basically have the DAO enzyme just genetically not work very well either. And then there are high histamine foods. Luckily, hopefully our children are not drinking alcohol, because that's a big one. Any fermented food, so think about kombucha and kefirs, and sometimes people use those. But if you have histamine issues, maybe that's not going to work very well. Some aged cheeses, some of the nuts, avocados, which I love, that can be that. And then histamine releasing foods. So just kind of think about in terms of diet, because if you really do have a lot of mast cell issues in histamine food, especially digestive, you really need to probably lower the histamine in the food and do the enzymes. And these are just some low histamine foods with healthy fats. And so the DAO enzyme supplements, as I said, you can just buy those. They break down the histamine, but only in the gut. So that means if you already have mast cells releasing histamine in the body, that's not going to help that. It's only going to break down the histamine that you eat, which is why it's really good for histamine intolerance, but not the mast cell, because it's not going to tell the mast cells to release any less. So I think this is a good add-on treatment, especially if there's a lot of digestive issues, but probably doesn't help as much for like mast cell activation. It's kind of like one tool. It's not going to take everything down. And this just shows how histamines can overload your system. So you got mast cells that are releasing this. You don't have enough of a good enzyme in your gut, and then you're eating histamine, and then you get histamine overload, right? So basically your body they're supposed to naturally get rid of the histamine. Well, basically we're having too much histamine in the system. So probiotics, interestingly enough, there's certain probiotics, right? We're supposed to have all these good bacteria. So there's certain probiotics that actually help you break down histamine. There's also some probiotics that increase your histamine, which is probably one of the reasons that some people don't do well with certain probiotics. Now, soil-based probiotics, which can also be helpful, do not affect histamine at all. So those are sometimes more tolerated. The probiotic I like best on this list is something called Lactobacillus rhamnosus. Sometimes it used to be called Lactobacillus GG. This has actually had some studies in terms of eczema, so I like it with eczema. It also, breaks down histamine, and it also helps keep a type of bacteria called Clostridium in check. So I like that, along with some of the bifidobacteria. And again, this is kind of a good list just to kind of make sure if you're reacting to histamine, that's probably why you don't do well on certain probiotics. Now, people know a lot about antihistamines, right? Just like it says, antihistamine. It's really trying to block. So histamine has to bind to, it's like histamine's a key, and it has to bind to something in order to start a reaction. So you can block that binding, then histamine doesn't have any action. So most of our allergy medicine are H1 blockers. So think of Benadryl, Claritin, Zyrtec. So natural H1 blocker is something called stinging nettle, which is in a lot of allergy medicines. Now, there are histamine, basically receptors, right, is where the histamine binds to in the gut. And those are H2 receptors, so they're different kind of receptors. So if you're blocking those, think of like when you have increased acid, which is sometimes from mast cells, so Zantac, Pepcid, some of those. And natural H2 blockers are peppermint and ginger. So you think about those when you have stomach upset. So those are blocking the histamine, but they're not stopping the histamine from being released, right? So we want to look at things that actually inhibit the mast cell releasing histamine, mast cell release inhibitors, basically. So there are some natural ones, and the group of kind of herbs that we have are in a group called flavonoids. And flavonoids are a type of polyphenol. And the only thing about that, so basically these are, the way I think about them, these are like what give a lot of our fruits and vegetables those deep, deep colors. So resveratrol is like a polyphenol. Now flavonoids are kind of a group of that, and they decrease inflammation, are antioxidants. They take care of all those free radicals that are causing damage to our tissues, and they inhibit mast cell activation. So some of the ones, a lot of people know something called quercetin. Now luteolin is another one. And Dr. Theourides, a lot of his research is looking at quercetin and luteolin in terms of asthma. In terms of autism. So those are kind of the ones that have been known probably the most. And he has a product called Neuroprotect that has those, and he developed that, except that they're little fat gel capsules, so sometimes they're hard for kids to take. Rutin, fisetin, and perilla. So those are all flavonoids, and all of those, basically they all work the same way in terms of inhibiting the mast cells. And so there is research on some of these, like fisetin. I said Dr. Theourides has a lot of research on quercetin and luteolin. The main problem with some of these is they're not absorbed very well. So you have to be careful when you basically go looking at doses or types that you actually get one that is, sometimes they actually put them in phytozones or they put them with fat. And that helps the absorption. So you really need to look at kind of doses. And if you don't have a highly absorbed form or form that's in fat, then you really do need to probably take it with fat or do much higher doses. So nettles, as I said, is an H1 blocker, but also helps the mast cell. So this is a really good thing to put some of the nettles with some of the flavonoids in terms of natural. And when I target mast cells, I like do everything. I use the prescriptions, I use the natural approach, because you really need, these kids who have this mast cell are really sick. And then you always have to look for what is really triggering this. So in terms of medicines, I talked some about the H1, H2 blockers. There are basically kind of two mast cell inhibitor prescriptions. One of them is called cromolyn sodium. It's a medicine that we've used for asthma for years. And there's an oral form called gastrocrom, and there's a nasal form, nasocrom. And those can be helpful. I feel like with any of this, for treating mast cells, there's no just one treatment. Even with allergies, there's no just kind of one treatment. You have to modify the diet. You have to treat the underlying infection. You have to target the mast cells. You have to target the histamine blockers, right? So it really is a comprehensive, depending how bad the mast cell activation, it could take time and it could take layers of treatment. So ketotifen it's really a compound oral prescription. And it does a mast cell inhibitor. It's really something that we really kind of thought more working in the gut. It hasn't been the end all be all if I've used it alone. And again, I don't think any of these used alone. There are some asthma medicines used, Singulair, albuterol. If you have that kind of respiratory component, you obviously have to target that specifically too. And then I talked about a little bit, because these mast cells are causing inflammation, they're basically making the immune system go crazy, releasing all these different chemicals that cause inflammation in the body. So you got to target the mast cells, but you also have to target the inflammation. And inflammation and oxidative stress are the same thing. Oxidative stress is like you have too many free radicals. And free radicals are these like electrical compounds that go and basically attack tissues and cause damage and cause inflammation. So we know a lot about the anti-inflammatories, antioxidants, like our vitamin E or vitamin C. And then think of things that a lot of ours are polyphenols, bigger curcumin, right? The resveratrol, T, EGCG, N-acetylcysteine. Our probiotics are actually anti-inflammatory. So adding some kind of anti-inflammatory or combination there is really important. So it's kind of, you have to really treat it It really is a holistic approach. And the other thing is the balanced immune system. So the T cells, these are health cells. I wouldn't worry about those, but look at the white boxes. So you have infection, inflammation. Your immune system has to fight infection. If it's trying to always trying to fight infections, you get inflammation. Part of the immune system is what deals with allergies. Part of the immune system deals with immune tolerance. Immune tolerance means that your body is not going to react to every single thing that it sees. Not everybody has red dye and has an immune reaction to it. You want immune tolerance and then autoimmunity. So if your immune system is imbalanced and you have mast cell activation, you're not going to have good immune tolerance. You're going to have allergies. You're going to have inflammation, and you might also have infection and autoimmunity. So this is ideally, if you have a balanced immune system, you don't have any of these. But if it's not, then you really need to try to balance the immune system so your body doesn't have allergies and doesn't cause the mast cells to release all the time. There's something called transfer factors. So transfer factors are like little bitty proteins that are released from a special white blood cell called a T cell. A lot of people know immunoglobulins. Think about if you go get IVIG, you're getting a lot of immunoglobulins. So these are like small ones. They help balance the immune system. They help your body fight specifically viruses and really difficult diseases like Lyme disease that trick your immune system. And then it takes care of those allergies and those mast cell reactions. So that is my talk. If you want to write a question, please feel free. I said you can also, that's my email. You can also target me by email. So I think the bottom line is we're seeing a lot, our kids are getting sicker. And if you're listening to this, you probably have a child with some kind of chronic issue. And things we're seeing more allergies, more reactions to food and the environment, more infections, more autism. Our kids are getting sicker. And identifying this piece of the immune system, the mast cells and the allergies, and trying to treat it is going to bring down the inflammation, bring down the symptoms, and basically help. Basically, a lot of this, you think about symptoms, really make these kids feel a lot better. And then when you do that, it's much easier to treat Lyme. It's much easier to treat these infections if you can get these mast cells. So a lot of the integrative adult doctors, when they have these patients, say they have a patient with Lyme and mold and POTS, and these people are reacting to everything. They can't go anywhere because of smell or, these chemicals. They treat the mast cells first. They bring these all down, so you have less reaction, and then you balance the immune system, and then you can start to treat the underlying cause of what's triggering all of this. So I think that that's the general idea. Really introduce people to, all of this mast cell stuff, which is becoming more and more common, people identifying, and realizing that, you always have to look for the infection. But it really is important to kind of identify and kind of go from there and treat. So I'm going to look and see if you guys have any questions. Hopefully, I did not overwhelm. So what was the question of the NeuroProtect supplement? So NeuroProtect is NeuroProtect. I said it's Dr. Theorides it's his, I think you just look up NeuroProtect. I don't know what company it is, and I'm not sure if it's a physician only. In terms of nettles, there is something called Histoquel, which is another supplement that has nettles and some of the flavonoids. Those are the two I know. There are a couple that have combinations. I think the important thing is to make sure you have some of the flavonoids. I think the more the better, and stinging nettle. And then for the more severe kids, you're going to end up probably on some prescriptions. So next question is, do the psychiatric medicines mask mast cell symptoms? I am not, I think of the psychiatric medicines, they might mask some of the neurologic symptoms, some of the depression symptoms. I wouldn't think they would mask any of the other symptoms. So maybe you don't have some of the mood symptoms, but you still could have the brain fog and attention issues, memory issues, things like that, along with all the systemic issues. Okay. All right. Well, I'm going to end this webinar, but I said I thank everybody for joining me today. If you have any questions, email me. And I hope this is beneficial. Any feedback would also be great. And I wish you all a happy holiday and a happy new year. Thank you. Bye-bye.